But then I started having this pain, this really bad pain in my right leg from the neuropathy. And I said, I'll go back and see if he can come up with something else. And then he told me about this new technique that he had. He tried to explain it to me, but it was a little above my head, the technical terms. But anyway, he said, would you like to try this? I said, I'll try almost anything because the pain was, it was just so unbearable. So even getting in the shower, if the water hit it, it was so sensitive. So he started this new method that he started on me, and I noticed the pain was going down my leg from where it was before. And I think I've been on here, I don't know, maybe about 2 months maybe, give or take. And I noticed the pain is not like it used to be, and it's really been bearable. Well, the treatment that he's using, he puts this like headphones just slightly behind my ear, and it has a pulsating sound, a rhythmic pulsating sound that goes on and off. And he wants me to concentrate on the sound. And while I'm concentrating on the sound, he has this instrument, and it goes up and down my leg where the pain is. And he does that for about 2 minutes. And then after he does that, he turns the machine on again, the pulsating sound. And then what he does is he gets his index finger and rubs up and down the area where the pain is, and then he gets his other finger and rubs on my arm where there is no pain. And what he's trying to do, from what I understand, is having the good overcome the bad by jumping over.
So I want you to get what I'm doing down here and also kind of maybe show what we're going up on his ears. Okay. So you put your hand down here where you can't really see it.
Okay.
Then I'm going to stroke your hand and your leg, like the bend it on. We're going to do it at roughly about the speed of your pulse here.
Okay.
Chris, can you zoom in on the pulse meter on his hand?
Yep.
And then you can want to come around us here and see if you can see what I'm doing.
Show his numbers.
And John, you're watching my hand on your leg, right?
Yes.
Okay. So really focus on the leg. That should be good, Chris. Thanks.
The pain that I used to have isn't there anymore. It's just an odd feeling, because I'm used to my leg feeling one way, but prior to coming here, the pain was pretty excruciating. Well, the spinal stenosis and the neuropathy, I was classified as having my 4th and 5th vertebrae degenerative. That's been going on for years. But then when I found out I had diabetes, I started getting really strange feelings in my legs, and I was told that that was neuropathy from the diabetes. So I decided to go and see if some type of treatment can be done. And I went to, I don't know, 3 or 4 different chiropractors. I went to 2 pain specialists where I had the injections. The injections did not work. I've had traction from one chiropractor. The pain was so excruciating, I wasn't really able to withstand that, so I had to stop that. And then I heard about Dr. Kukurin, so I said, I'll try him. I mean, I was trying any and everybody because the pain was just, unbearable. It was just so uncomfortable. But as far as the excruciating pain that I was having prior, to the treatment that he was giving me, it seemed to work. To me, at first, it seemed weird. The technique. I said, is this a mind over matter thing? He said, well, to some degree it is. But I said, if it's working, fine. I have no complaints. So right now, the pain that used to be there is not there. It's just Well, I would say the pain that I had prior to this was probably around an 8 or sometimes a 9. I mean, some days it might have been a 10. But I would say right now, maybe about a 5, 4 plus. But it's nothing nearly what it used to be. But it doesn't hurt. It's just a strange feeling. But it's not, an excruciating pain. It doesn't hamper me when I walk, because I like walking, and that's good exercise for me. But it's something that I can deal with and live with. Whereas before, I mean, just getting in the shower or touching it, it would